Osteoporosis is a very widespread disease. It increases with age, and it's a common problem in the population, both among women and men. But it's quite a young field of scientific investigations. It's only been around 25 years that we have had treatments for osteoporosis, and the diagnostic procedures are of approximately the same age, 25 to 30 years.
And I think it illustrates pretty nicely actually what the Journal of Internal Medicine is about, because it describes a broad field of great clinical importance. It goes into that field in several areas: basic science, applied sciences, clinical practice, and you can say community advice. So it illustrates the broad field of medicine and the different approaches to understand the mechanism behind the disease and how to deal with the disease when you're responsible for patients. So, because I don't think people understand what medicine in a broader sense is about, and particularly not what our journal is interested in or deals with. That it deals both with the very basic sciences as well as the very practical consequences of the improved understandings.
For the last 10 to 15 years, a very important mechanism regarding how bone cells are regulated. The bone cells determine bone quality and bone strength, which of course determines the risk for fracture. So we have spent quite a lot of time discussing this regulation in bone cells, and that's very important also because this is where we will see the new treatments come.
Well, I think this symposium very nicely summarizes some of the most recent developments in the field when it comes to basic sciences. I mean, the wind signaling system and things related to that, possibly new targets for treatment of osteoporosis. Of course, that is not unique for this symposium, but that's a good summary of a very special part of the basic sciences. It also, in a very nice way, by some of the very most senior persons here in the meeting, Steve Cummings, for instance, who has spent his whole entire scientific life dealing with questions around this disease or these disorders of the skeleton, and describes from a very, very broad perspective what has come out of it and what we know now today and can move forward with. So I think it's illustrated very nicely the depth of the science as well as the huge experience we now have in this field.
This meeting contributes to the field of osteoporosis by bringing scientists together. The scientists can share their thoughts, and we have had good discussions among the scientists. So I believe that every meeting also raises lots of ideas among the scientists and also provides the possibility for new collaborations and the development of this field even further.
I think what most people who are not deeply involved in this type of research before, when they read this issue of the journal or the papers in it, I think they will be surprised by the complexity of bone biology and the depth of understanding that we now have, and how that can be translated into clinically relevant information from drugs to treatment of patients. Because most people, at least a few years back, believed that the bone was quite a dull organ. It was just a sort of a plumbing tool or something like that, rather than a living organism that has interactions both with fat, with vascular tissue, and with bone marrow. So I think they will understand better that bone is a living organ, has a very central importance, not only for the structure of the body, but for many other functions as well. And I think that's very nicely illustrated as well in this meeting.